Welcome to Performance Guaranteed. I'm Teira Gunlock,
And I am Elena Gambin.
and this is the podcast where we spill the tea on leadership, the habits, the decisions, the disciplines that drive performance, because great results don't happen by accident.
Every single episode, we are going to sit down with leaders both inside and outside our organization to unpack what actually happens when we find and achieve performance, not just what looks good on paper or gets posted on LinkedIn, but the nitty-gritty and the details.
Awesome. I'm super excited to do this with you, Elena. But a few questions before we dive in with our guest. So, first one, what did you believe about leadership at 25 that you laugh at now?
The idea that good leaders know everything. I think
I've
when
definitely proven otherwise.
boy, am I with you there. So many wrong decisions. Truly, I mean, when you're growing, you look at people you admire and you think, my gosh, the expertise, the knowledge, the skill, and neglect to understand that it is in fact good leaders usually what they know is how to surround themselves with really good people who know more than.
Case in point.
Yeah. Well, case in point across the board. What about you? 25, you're new
I
to
would
the
say
scene.
this is perhaps true of many 25-year-olds insecure in their own lack of experience, but I would say mine was just that you had to have experience in the thing to do the thing.
Yeah.
And have, I think, since, realized that there are lots of different aspects that make somebody good in their role or a good leader. Experience is great, but not always necessary. So
Yeah. Not as helpful, honestly, sometimes as asking good questions and being
and
Socratic, which is something that we've all kind of learned, I think, together, honestly.
yeah,
That's a good one.
I would totally agree. All right, so next question number 2. What feedback have you heard most often?
I am going to be vulnerable here and say that on more than one occasion, I think this is coaching you've given me too, Tira. Uh, Regulating my reactivity to things is a really important uh, achievement as a leader, I would say. Not that emotion is bad, especially if you are an emotional person, which I subscribe to that, but knowing how to take in stress, bad news, rough things, and apply a layer of rationality to them. That is a piece of feedback I get with some degree of regularity.
Yeah, emotions are so helpful, and yet they can also
Until they're not.
get in the way until they're
Yeah.
not. Yeah, exactly.
You got to like go cry before and after work, not at work. Just kidding. How about you?
Yeah, I would say
Here?
as a kid, the most frequent feedback I got was shh, because I chatterbox. As an
This
adult,
podcast is perfect for
I
you
know,
then.
living the dream. I would say as a working adult, it's probably been to listen to my gut. I think I sometimes like want to over analyze things or await for perfect information before doing something. And so I've been growing, I think, through that. But it's like listen to my gut, act on it. I mean, obviously, not to the point that it drives people
gut.
crazy, but but I think that's what I've got.
It's a good gut, TG.
Often. All right, last question. What topic do you think leaders understate?
This is not going to surprise you or anyone who knows what I do, but communication and how it should happen, how frequently it should happen, best practices, how to teach communication. I am just so overwhelmingly convinced that most things can be solved with better communication, especially as organizations get larger.
Yeah, I don't disagree. I think it kind of underpins everything.
Yeah.
My response to that would be prioritization. So I was
Yeah.
thinking through this, I think especially as like for a growing organization, I think it's very easy to work hard and it's harder to work effectively. I think it's, I've always worked hard. Like I feel like, that's a steady line, but like the effectiveness has been more jagged.
Yeah.
Growth, right? It's just it's a journey.
Tira, did you know that so I have a notes, we all have a notes app on our iPhones, but I have a notes app called Learnings from Tira. And earlier this week when you said the quote, effectiveness is not the same as working hard, I wrote that down. So just know It's going somewhere.
Let's go somewhere. Great.
It's going
Inch and a half.
somewhere. Yeah, right. And I'll pull it back out
Yeah.
at some point.
Awesome. All right. Well, let's bring in our first guest, our esteemed first guest. Dr. Cole Barfield is our Chief Medical Officer at First Stop Health, an internal medicine physician, digital health founder, and someone who has led through some of our most meaningful and complicated growth moments. So, Cole, welcome to Performance Guaranteed.
Thank you
Hello.
so much for being here. So much fun.
All right, we're going to continue on with the quotes because I think one of our favorite quotes around here, and in fact, I think Elena, you use this probably quite often, is from Hans Rosling in his book Factfulness, which is progress often feels messy when you're in the middle of it. And so I know we've made a lot of changes internally over the past year, the launch of Whole Mental Health, I think furthering team-based care. And I think that sounds really smart and strategic. I mean, I should, since that's what we decided to do. But in reality, it probably felt quite a bit different. So, Cole, when you hear progress is messy, what comes to mind for you?
Yeah, I think a couple of things. I mean, I think first and foremost, healthcare in general is just messy, and it can be hard and can be time consuming in patient care and the operations behind it. And you've seen that kind of play out in some of the ways in which we're actually delivering care today. One of the things when I first talk about like progress is messy, one of the things actually it takes me back to, honestly, is my origin story of like what actually got me into where I am. I was in college and I was a politics major. Had a
You were?
desire
I
to,
didn't know
yes,
that.
isn't that crazy? So I
Yeah.
was a politics major. I was interested in health policy. Did not have, I had some family members who were healthcare, who were providers and all this stuff. And I had a desire to do it, but I didn't want to go through all the work. But then I went to South Sudan. Actually, Sudan at the time was the longest civil war in the world at the time, about 25 years or so ago. And one of the things that I realized is that I went there to do research on my senior thesis, and I interacted with a medical mission physician. And all of a sudden, what I realized is that it was a mess over there. People couldn't access care, they couldn't afford care, and the outcomes were bad. And one of the things that I saw, though, in that is that progress was one patient at one time, seeing a
Yeah.
patient, having access, being able to afford it, and then seeing outcomes on the back end. And so oftentimes I look at that story because that's actually what propelled me to go into medicine. And it was a mess for me because I wasn't, sciences aren't my thing. I didn't know if I was going to be able to get through medical school, but my mission was oriented towards being able to provide good access to patients at an affordable cost and leading to great outcomes. And so, one of the things that I think of my journey is that it has been very messy, even for myself, not just our projects that we're doing. And yet, there's progress intermittently alongside kind of a focus on the mission of really providing great care that's affordable and that leads to great outcomes.
That is a really, I did not know that was your background
Yeah.
story, Cole. That's,
Yeah.
would you say that you're maybe, and I guess this is maybe, I wonder if this is true for anyone who goes into this space. It's like you're a little drawn to the mess itself because
Yeah.
that's where you see the work.
Very
And
much
if there
so.
maybe if there was no mess in healthcare, it would be less interesting to a brain that wants to help and solve a puzzle like yourself.
Yeah. I love that. I was actually in residency at the time. I was at Vanderbilt, and I remember distinctly taking care of a patient who was ready for discharge, but actually could not go to a nursing home because of insurance approvals and physical therapy evaluations and all this thing. I was sitting here thinking, God, this is such a mess. This person is ready
Yeah.
to go. They're ready to go, but they can't go to the place that they want. And that actually propelled me to go to business school. And so, to your point, though, the thing about healthcare that to me is so impactful is that it is a mess. And yet there are so many opportunities to make such an impact. And you can take just that small sliver of progress. And even though it's really messy, you can make a significant impact in patient care and in the delivery of care across the country.
I want to talk about you as a leader dealing with mess, which is, so I'll just say, my perception of you, dear Dr. Cole, is one of the kindest, most thoughtful clinicians and leaders that I've had the fortune of working with. And so it is hard for me to imagine you getting that stressed out, angry, or emotional, like myself, when you are encountering mess. But when you are in mess, what is your first instinct? And then what do you have to do to work past it?
Yeah, it's a great question. I think there are three things on the hardest days. The three things that really come to mind for me is really what's the why. Like why
Yeah.
are we doing? Why are we in this mess? Like what is our purpose? Is there clarity to that mission and things like that? And so oftentimes I can get. We talked about feelings earlier. I can get kind of emotional, and yet if I orient myself towards like what is the specific purpose and mission of the why of why we're doing this, then oftentimes it takes me out of that situation to where I can reorient to that. So that's the first thing by far. The second thing is something my grandfather taught me, and in particular, he said, "Good people beget good people." And one of the most important things is you mentioned it around surrounding yourself with good people, and in particular, in those hard moments, if you surround yourself with the right people, then all of a sudden that community helps the messiness feel
Yeah.
like actual progress. And so, like for me, it's really being a good person, but yet also surrounding yourself with good people, so that even though there's hard work, there's also progress that's being made in those instances. And quite frankly, it's along a little bit of what you had mentioned earlier, which is acknowledging your own weaknesses and vulnerabilities and being able to build that team around those blind spots.
It I love that. And one question I have is you have to embolden the people that are surrounding you with the same mentality of mess can be
Yeah.
okay. So I
Yeah.
guess the follow-up question to that would be either for your direct reports or maybe your peers, because I think you do this a good amount, good left and right, as maybe as
Yeah.
well up, is how do you help someone else get through the mess? Right? Like if
Yeah.
if your team is going through something that is just going to be messy because it is hard work, it's really complex problem. It's going to be that way for honestly maybe a couple months, like a prolonged period of
Maybe a
time,
couple of years.
maybe a couple years. Yeah.
Yes.
What are you saying to your team to help them to like reduce the burnout, prevent the kind of fatigue?
Yeah.
Are you just sharing your own experience with it? What
Yeah.
are you doing?
Yeah, I mean, two things. One goes back to clarity of the mission. I mean, I've literally in the past 2 weeks, we have some messy things that are going on that we want to strengthen some of the organization, and some of them are massive projects. And so part of it is like, what is our purpose? Just that one thing is so grounding, I think, for people as we go through it. Of just like, hey, listen, take a step back and look at what we're trying to build, and this is exciting. The second thing I would say, and I don't know, have you ever heard of the 1% rule or kind of the aggregation of marginal gains? So the idea is that we want to look at what the purpose is and make 1% improvement in what we can do. And I loved my daughter. I have a 15-year-old daughter who's a very good gymnast. One of the things I've loved the most about watching her gymnastics is she goes practice a lot, but she makes
It's
incremental
incremental
1%
tweaks.
improvements to
Yeah.
where then she goes to a meet, and all of a sudden where she wasn't able to flip on a beam, all of a sudden she is able to flip on a beam 3 months later. And it's that focus, and then also kind of the understanding of like, we need to make what's that 1% improvement that we can make towards that goal, and seeing those small wins go towards the bigger win later down the path.
Well, that's so good. I'm gonna write that down. The other one that I wanted to offer up was thinking about things on a different time horizon. So
Mm-hmm.
a couple of years ago when I broke my back, it was feeling better for a while and then it started to feel worse. And I was talking to my fiance Peter about it and he said, wait, wait, wait. And he literally pulled out a piece of paper and he drew on the graph that if you're just looking at, a 10-day horizon, you might be seeing that you're
Yeah,
decreasing. But over time, the increases and decrease has a positive upward trend line.
Yep.
And if
love it.
you like go up, go
Zoom
backwards,
out.
uh,
Yeah.
yeah, zoom out,
Yeah.
there is just so much progress on the dips, and the local mins and maximums don't really matter as much. And I think there's probably something around being able to quantify that for your team, or at least talk to them
Yeah.
about the idea that helps them like train their brains to think that way. Cause it's so easy to feel like, wow, Friday was way worse than Wednesday. We're
Yep.
on a downward spiral.
Love that.
Yeah. It's human nature to zero in on what went wrong as opposed to what's going right. Even though it's like, yeah, when you zoom out, actually, it's like, it's pretty remarkable. Yeah.
Yeah,
I,
I can think of one of the things when I think about our mental health product in particular. We've added so many different providers, and in the thick of it, it was like oh, this is so hard. And, we're
Yeah.
scaling access to care across the country and all this stuff. And yet when you sit back 6 months later, you ought to reflect back and be like, oh my God, we built a network that is accessible, that provides great care, and we're solving a big problem. And that is so awesome, even though in the midst of it, it was extraordinarily difficult with regards to the amount of providers who were being onboarded.
Yeah. I also think too on the hard days point, that we were kind of talking about earlier, like there's two different parts of it, right? It's like part of it's the vision and like centering on your why do you want to go this direction. And then the other is kind of like the outcomes and zeroing in on those. So it's, one of the things that I think I've talked about for years is like on a bad day or a bad week, I just go read patient comments, right? And then it's just like, and it brings you
Yeah.
right back to it's like that I don't know, that loop basically.
Yeah, the other one I'll highlight, so from a sales and client success perspective, you can go a while without any little wins. And the second you get a little win, all of a sudden your attitude about yourself completely changes. And so I think it's equally as important to almost train your brain. It's like a gratitude journal. It's like a little win journal. Train your brain to
Totally.
recognize the bumps, the bump ups, the wins, because that it actually changes how you interact with your day, and then you are showing up better. So you can't have a constant stream of setbacks. There has to be some little micro wins, but if you sit in them, it
Yeah,
really
you got to
helps.
celebrate the 1% gain, right?
Yeah,
You got
you
to
got to
celebrate
Yeah.
that.
celebrate. That's well
Yeah.
said.
Love it.
Celebrate
I'm
the 1%.
I'm curious, Cole, has there been anything that you've had to unlearn
Hmm.
throughout your time as a leader?
Yeah, good question.
Mm. Yeah, I think the things where I feel like I have to unlearn or maybe relearn is oftentimes I like to be a nice guy. I like to be well liked. I like to be loved by people. Um, and oftentimes that is not necessarily always the right thing. So you can be a good person, a good leader, and also be able to provide direct feedback and be able to provide clarity on outcomes and things like that. And I think my learned behavior was like, you want to win people over, you be kind, you be nice, you do all those things. And yet, as a leader, I've had to harness the good in that, and also understand kind of how can I be more clear in the way that I deliver feedback, for example, or in the way that I measure teams' outcomes and those types of things. And quite frankly, like I'm still learning that. Like, I mean, I talk to you both about it, consistently. Like this is a growth opportunity that
Getting better
always holds
though,
up,
don't you
right?
think?
Just what you said. Like this is the theme, right? Progress
Yeah,
is
right.
messy, right? And
Yeah.
like my progress is messy, and yet we're seeing improvement, And so those are just things that I kind of consistently, yes, have unlearned and also relearning new skills and building muscles in those areas.
Yeah. Oh my gosh, I totally sympathize with that. Or because I think I've been on the same journey in terms of just like getting like letting go a little bit of likability. Because the other thing that
Yeah,
I will say is that people like to work on teams that are winning, right?
yeah,
And so
Yeah.
sometimes to be able to win, you have to say the hard thing, right?
And do
Doesn't
the
mean that you
hard
have to
thing.
be
yeah.
unkind, but you have to say the hard thing.
One of
Yeah.
the things, and I know you know this about me, and I've talked about it. I really like a lot of what Brene Brown has to say, but one of the things that I always have mentioned and has been really important for me on my journey, on my kind of like journey in both myself as who I am and also as a leader. But it's really around, being clear is kind, and I love that idea that like even indirect feedback, clear can be kind, and that you're giving that person receive it, letting them receive it, and also be able to grow in that. And also clarity of mission, all of those things are important. So anyway, I love that quote, and it's something that has always kind of centered me on my growth journey.
It is interesting when you think about the best pieces of advice you've gotten in your life. It's usually someone took the time to say a hard thing that
No,
turned you on a path for better. I remember I had a manager who called me once and said, "Don't ever use the word value in a sales conversation that has no meaning. Say the thing. Use the
no,
example." And it completely opened my mind. And I was at the time I was, oh God. I have failed you. But
so
he
true.
took the
I
time
love
to
that.
call me and talk me through it for 15 minutes. And it was really important critical feedback. The other part of, on the flip side of this, Cole, is as important as it is to stay in the mess and see it through and see the incremental progress and get that 1%, I think one of the things we forget as leaders is that one of our most important jobs is to make hard decisions. And that includes when to stop doing things that are
Yeah.
always going to stay messy. And so I guess when momentum is slowing, how do you decide when to push
Yeah.
or make the decision? I mean, we just had this internally. I can think of an example. We just did this, you and I together, Cole, on a
Yeah.
project related to a new service
Yeah.
line. Like, when do you decide we need a different?
Yeah, yeah. Love that. I mean, I think there are two things I would say. One is that project mission aligned? So that's the first and foremost thing. The second thing, though, on like, do you iterate, do you push, do you pull back, and all those things, is really identifying like, okay, this is mission aligned, and yet what's the data that we have? Or to Tira's point, a little bit about a trained gut, which is like, this isn't feeling right. Like, what do we need to do to actually realign the mission to this and make forward progress? So, Elena, to your point on something we just did, it was one of those things where we realized that, oh, it was a bigger group. Let's take that back. Let's take it smaller. Let's refocus our efforts towards a smaller incremental wins and be able to take a bigger project and make it two smaller projects, right? So those types of things are so important. And quite frankly, when the data states that you should probably stop, you need to listen, right? And
Yeah.
so there are aspects of, for me, one of the aspects as a clinical leader, growing in my ability to lead across the organization, it's one of those things where making data centric decisions is also really important in those things.
And not succumbing to that sunk cost fallacy, right? Just because you've
That's
worked on
right.
something for a
That's
few
right.
months
Yeah.
doesn't mean you should continue it. Just because you've put the money in
Yeah.
doesn't mean you, right? And
And it doesn't
yeah,
mean it's a loser either, right? Like,
yeah,
you can make that's okay to say no to it
simplify.
because we
Yeah,
did it. We
Yep.
simplified
Now
and
we know.
moving on.
Yeah.
I love it.
Yeah.
yeah.
I know. Inertia is such a
What a
powerful
satisfying feeling.
force. So,
Yeah.
yeah.
Yeah, the ball continues to go on the path that it is on until someone
Yep.
redirects it.
Yep.
Yeah.
Yeah.
So I'm curious. This is our quick sips section. So we're gonna move along, and this is
Rapid
like the
fire.
first. It's
Ooh,
rapid
love it.
fire. It's first instinct. There's no disclaimers, even though you're such a wonderful storyteller. There's no storytelling here. So short
All right, I'll
answers.
keep it quick. Short
Yeah.
answers.
Yeah.
Got it.
Yeah.
A tight 10. Tight 10
Tight
seconds.
Yeah.
10. Yeah, exactly.
Yeah.
All right. Question number one. What metric lies to most leaders?
Ooh, that's interesting. Fee for service world and healthcare, it's all about volume, right?
Mhm.
And even here, we're
Yeah.
talking about utilization and things like that. But the problem is that it can't just be volume alone. It can't be just utilization alone. You have to have the progress and the outcomes. And so I oftentimes think of it's the match of utilization, but and yet also the outcomes with regards to clinical care and some of those things as well.
Yeah. The whole picture. All right. Question number two. What's the biggest hidden lever in employer healthcare?
Ooh. I think the leverage for us as a company, it's really about building trust. So we have got to enable great access to care, affordable care, and deliver great care. And in doing so, the most important thing we can do is to build trust, trust with the patients, trust with our clients, so that we can continue to provide value to both of them.
Yeah.
The
It's a
trust
privilege.
equation runs
Yeah,
rampant
it
everywhere.
does.
Yes.
And it's a
Yeah,
privilege, right?
it
All
is.
right. Number three. What bias do you watch for in yourself?
Ooh. Um, the biggest one I think that I think about on the is probably in the innovation and the technology front. So every single technological improvement, I think of like, ooh, yay, this is going to transform things and this is going to make it easier and lower cost and all that stuff. And yet, the reality is that it has to be grounded in the ability to make behavior change with patients. And sometimes that encounter it's actually more human based. And so with all of the technological innovations of AI and all that stuff, which absolutely will transform healthcare, when I think about it, in reality, it comes down to also just the patient and provider relationships in essence with that technology.
Yeah. There's always a place for the relationship, right? All right. Final question. What leadership lesson did you learn too late?
Ooh, I'm still learning it, and I will say, I will say, and I mentioned it earlier, but it is honestly, it's around being courageously real and being clear as kind, and honestly, it is something that I constantly want to grow in. And I'm surrounded by amazing leaders at this company that continue to pour into me on helping me on that journey. But it is something that I wish I could go back to, 25 years ago and be like, hey, it's not just about being likable. It's about being clear, and clear can be kind.
I think it's never too late to learn that, Dr.
I know. I'm getting there. Progress in the works.
I have loved so much of what you talked about today. I will say one thing that's really going to stick with me is I have in my head the 1% incremental improvement when things are messy, and the celebration of that 1%. And it is, I think, regardless of what role you have and what department you're working with or what industry you're in, incremental improvement is hard to deny that it is those are the building blocks of traction. There's really no other way to do it. So thank you for sharing that. That was really helpful. Before we wrap, we have a fun surprise for you, which
Great.
is we asked two people who work with you closely to describe your leadership style as a hot beverage.
Oh, beautiful. Can't wait to hear.
Get it? Okay. So, Teira, I think you have those.
Yeah, I have these. So Mary Kane, Senior Vice President of Quality and Population Health, said that you were mint tea with honey, relaxing and sweet. And then we also have
I'll
one.
take that.
Yeah. We also have one from Will Setliff, who's our Chief Marketing Officer, who said you were mulled cider, elevated, approachable, and welcoming with natural warmth. You can tell he's in marketing. So do you agree with that, Cole?
Sounds beautiful. Sounds like I want to have a drink.
Neither of those have caffeine in them, so you must be like organically energetic. You don't need.
And Cole's not a coffee drinker, I think, right?
And you're not a coffee drinker. All right, how appropriate.
Boy, they really know him.
Yeah.
They just know you.
Well, on the 1% theme, I think we progressed 1% today because this is our very first podcast.
Yeah.
Cheers to you guys. Cole, thank you so much for joining us.
Yeah, and thank you. Thank you so much for your thoughts, and to all of the listeners that we have and will continue to gain over the time. We're really grateful for tuning in.
Thank you. Cheers, everybody. We had tree trimmers here all day, and they just, I think they're actually,
that is lucky.
Yeah, they're gone now, but it's been like chainsaws like up until like
what a treat
15 minutes ago. So luckily we timed it right.
I'm glad they made like a leaf and got out of there.
Get it out now, Elena. Get it out now.
My puns are painful. Like they are not. People don't like that.